Good morning, Trinidad and Tobago and the wider world. Thank you for tuning in today for today's virtual media conference hosted by the Ministry of Health, where we provide accurate and updated information on the national COVID 19 response. I'm pleased to introduce our presenters for today Dr. Miriam Richards, Principal Medical Officer, Institutions, Ministry of Health, Dr. Adish Sijasingh, Director in the Directorate of Women's Health, Ministry of Health, and Mr. Roshan Siram Singh, Manager, Geographic Information Systems, Epidemiology Division, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for today. We begin with the clinical update by Dr. Richards.
Thank you very much, Al. Good morning to my colleagues, Dr. Surjit Singh, Director of Women's Health at the Ministry of Health, and to Mr. Roshan Siram Singh, who heads our Geographic Information System unit. Good morning to members of the media. Good morning to our viewing and listening public, and thank you to all of you for tuning in locally and internationally as we continue to provide information on the Ministry of Health's response to the COVID-19 pandemic. Before I start this morning, I would like to acknowledge and recognize the selfless national service that continues to be carried out by our frontline health workers, both in the parallel healthcare system and in the traditional healthcare system. They have been working tirelessly and continuously to help save lives across both systems, and especially over the last 16 days when we have noticed an increase in demand for the care of intensive care unit level patients. This morning, I'd like to provide an update on the status of the parallel healthcare system, but before I do that, I'll just summarize the information on Media Release 896, which is as of the 2nd of November 2021 at 4 p.m. So I'll now move to that slide on the media release. There have been an additional 294 confirmed positive cases reported in the last 24 hours. This has taken the rolling average of cases over the last 7 days to 239, and as Dr. Hines would have indicated, this is a trend that we have noticed, especially over the past month, and then again increasing over the past 2 weeks. The additional 294 cases have taken the total number of active cases to 4,898, and these are distributed as follows. 4,243 cases of persons who are being under self-isolation and being monitored by the relevant county medical officers of health, 29 persons in step-down facilities, and 332 persons in hospitals. Unfortunately, 11 persons died over the last 24 hours, and this has taken the death toll to 1,720. We extend our sincere condolences to the families of the deceased, and we urge the population to please comply with our request to be vaccinated. This is our only additional tier that can save lives at this point. The vaccination status is as follows. 624,264 persons have been vaccinated with a first dose of a 2-dose regimen, and that is considered partially vaccinated. Completed vaccinations are as follows. The total number of persons vaccinated with a second dose of a 2-dose regimen, 569,997. 35,399 persons vaccinated under a single-dose regimen, that is the Johnson & Johnson, and 605,396 persons with a completed vaccination regimen. I would like to reiterate that a person is considered completely vaccinated once they receive their 1-dose regime, and there's a 2-week period, or if there is a 2-week period subsequent to the second dose of their regime. Full vaccination confers protection against transmission of COVID-19. It also prevents you from being admitted to the intensive care unit, and ultimately it prevents deaths from COVID-19. I'd like to now provide a summary on the status of the parallel healthcare system as of 8 a.m. this morning. The trends that I am referring to have been in place since the 19th of October 2021. So it's approximately a 16-day trend that has been consistent across the parallel healthcare system as well as the traditional healthcare system. The overall occupancy of the parallel healthcare system continues to be under 40%, and it's at 36% this morning. This is a trend that has been consistent now for 110 days. However, we have noted that the proportion of critically and severely ill patients, that is patients requiring intensive care unit level care, has increased significantly, especially over the past 16 days. This morning, there are 358 patients in the hospitals in the parallel healthcare system and step-down facilities. 29 are in step-down facilities, 329 are in hospitals. The ratio of severely and critically ill patients requiring hospital care to those who are recovering has increased significantly over the last 2 months, from 3 times as many severely and critically ill patients to now 11 times severely and critically ill patients. I'd like to now provide some information on the concerning trend that we have noticed, especially over the last 16 days, regarding the intensive care unit demand and capacity. As of 8 a.m. this morning, there were 29 patients who are COVID positive across the 4 regional health authorities in Trinidad, none in Tobago as of this morning, who are awaiting admission into the hospitals in the parallel healthcare facility. This number has ranged between 17 and approximately 34 over the last 16 days, and it represents a significant increase as previous to from July 15th to October 19th. 6 patients are awaiting care in the intensive unit departments, and some of those 6 are too critically ill to be transferred even though beds are available. So of the 6 ICU level patients, none are fully vaccinated. This is a consistent trend yet again that we have noticed since on or about the 19th of October 2021. So 100% of persons who require intensive care unit level care, either at the accident and emergency due to their clinical status or in our hospitals in the parallel healthcare system, are not vaccinated. Of the 29 persons who are awaiting admission to the hospitals, and that includes ward level patients, 25 out of the 29, or 86%, are not fully vaccinated. The number or the percentage of COVID-19 patients who require transfer on a daily basis from the accident and emergency departments to the parallel healthcare system has been anywhere between 18% and 37%. So we have noticed anywhere between 15 to 17 patients requiring care in the accident and in the intensive care unit departments. I'd like to reiterate that as of today, every patient who has required intensive care unit level care has been managed according to the regional health authorities' protocols on COVID positive patients requiring ICU or HDU care. The accident and emergency departments patients are managed, if too unstable, by the ICU teams attached to the relevant hospital, and they have been receiving the required care, including ventilation as needed. I'd like to now provide an update on the status at the hospitals in the parallel healthcare system, and I'll start with Tobago. Over the past 16 days, we noticed that Tobago had approximately 2 to 3 patients in the ICU. However, overnight, the ICU at Tobago has accepted an additional 3 patients. So now that ICU is filled, 5 out of 5 patients. Now, there are contingency plans in any hospital, but again, resources are limited. So Tobago is now at 100% capacity. And that was an overnight change, demonstrating the severity of the situation and the evolving nature. That is how quickly the ICU beds can become filled. In Trinidad this morning, there are 58 operational ICU beds. And as I would have indicated earlier, and Dr. Hines on Monday, we continue to observe and to analyze the trends, the clinical and the statistical trends, to reallocate resources to our best ability to increase the number of beds. However, these resources are limited, as we've been saying all along. There are 48 out of 58 48 patients in the 58 beds this morning in the intensive care units across the parallel healthcare system, and that's 83%. This is actually one of the lowest occupancies that we have noted because we've gone up to 95, 96% over the last 16 days. It is important to note that like the ICU admissions in the accident and emergency, the vast majority of persons in our ICU are not fully vaccinated. This morning, 46 out of 48 persons, or 96%, have not been fully vaccinated. So in Trinidad and in Tobago, we see similar trends of persons who are not fully vaccinated, requiring who are severely and critically ill and requiring ICU admission. I'd just like to summarize some of the trends that we have noticed. And I do this on behalf of the accident and emergency physicians, the ICU doctors, the medical chiefs of staff across our both systems. And they would like the public to notice and to take notice of the following trends. Firstly, persons continue to present to the accident and emergency department in a severe and critical state. 3 of the recent deaths, those are persons who would have passed away between Monday and today, were persons who contacted the GMRTT ambulance service. On arrival, the ambulance service would have assessed their vital signs and spoken to our medical and clinical transfer team. These persons required hospitalization and care. However, these 3 persons denied the transfer. Within a day, they had decompensated or deteriorated at home, and they were transferred immediately to the accident and emergency departments, and 2 out of the 3 were admitted into the parallel healthcare system. But unfortunately, these 3 persons succumbed to the COVID-19. These 3 persons were not fully vaccinated. The other trend that we have noticed with respect to the patients presenting, as I would have indicated prior, is that they are not fully vaccinated. We continue to see high levels of persons who are not fully vaccinated being admitted and contacting the GMRTT service. In fact, those that have been fully vaccinated tend to be either discharged home after they are observed or at ward level care. Now, the Ministry of Health and the RHA continues to do all that we can to save lives. We are reallocating resources. We have increased the number of ambulances and the advanced life support ambulances on shifts over the past 16 days. We have added intensive care unit beds. We have increased the capacity to manage ICU patients at the accident and emergency departments, and we continue to give every patient their chance to survive because we value every patient as a member of your family, of your neighborhood. However, it is now the responsibility of each and every one of you to please, I'm appealing here on behalf of the nurse, ICU nurse who was here, Nurse Bethel, on Monday. Please take the Ministry of Health offer up with respect to vaccinations. Vaccines are safe, they are accessible, and they are available across several mass vaccination sites and health centers 7 days a week. We have 4 choices of vaccines available at this point in time. Thank you very much for continuing to comply with the 3 W's. Thank you very much for observing the public health regulations. But on behalf of our medical team, please, let's all practice civic, social, and personal responsibility. Let's do our part to save lives. Don't delay. Vaccinate today. Thank you very much, Al.
Thank you very much, Dr. Abdul Richards. We welcome back Dr. Surjit Singh to the media conference. He is here to update us on the uptake of both COVID-19 and the flu vaccines in women, and more specifically, pregnant women. Dr. Surjit Singh, good morning.
Good morning, Al. Thank you for the introduction. Good morning to Dr. Miriam Abdul Richards and Mr. Siram Singh. Good morning, of course, to all members of the viewing and listening public, as well as members of the media. So, my job today would be to give my usual update on COVID 19 and as well as give you some information on the influenza season as it pertains to women's health. I have a few slides prepared, so can I have the first slide, please? Yeah, so next slide. Right, so just a quick update again. So these are our national statistics up to September to 2021. The statistics for October will be ready in a few days, but this was our last update. Our maternity and newborn services continue to perform very well, even faced with the issues of the pandemic. It's important to highlight that there were 10,810 births for this year, and the majority of these births occur in the public health sector, as well as all of the neonatal care that is required is done in the public healthcare system. Next slide. With respect to the update on the number of cases in pregnancy with COVID 19, and these are statistics up to last Friday, we now have 823 pregnant women in our database since the start of the pandemic. The numbers, as stated before, in 2020 we had 58. For the first half of this year, we had 303 cases. And then we started to see a significant rise in the number of cases being reported of pregnant women in the database from July. In September, we had a high of 161 women entering our database, and for October, we have 100 cases. Next slide, please. In terms of the general vaccine information, I've said this before. The Sinopharm vaccine was approved for breastfeeding women since June 2021. We then added the Pfizer vaccine for pregnant women as approved. All of these vaccines as well approved by the World Health Organization and our national immunization technical advisory groups. The Pfizer was added for second trimester and above as of end of August. And then we added Pfizer as well for breastfeeding women. So breastfeeding women have two choices. They can use either the Sinopharm or the Pfizer. In terms of the number of women, the slide actually, I didn't get a chance to update it, but Mr. Lawrence Jaising just sent me some new numbers. We have 833 women who would have had their first dose of the Pfizer vaccine during pregnancy as of 2 days ago. Some new information as well. We just had a national immunization technical advisory group meeting, and the chief medical officer has advised me that there is a peculiar circumstance where some women are coming into pregnancy having had one dose of the Sinopharm vaccine, and we have just approved that these women can now take the Pfizer vaccine as per schedule, 2 doses of the Pfizer schedule from the second trimester and beyond, and we will be sending out some correspondence on that during this week. Next slide. Just a reminder again, this comes from the Center for Disease Control. Pregnant women are at increased risk of getting severe illness if you contract the COVID-19 as compared to the healthy population. This infographic says there's a 70% increased risk of death if you are pregnant and contract COVID-19. You've heard the numbers. 823 women have contracted COVID in Trinidad and Tobago, of which 2 to 3% have ended up in our intensive care unit and high dependency units, and we've had 2 deaths of women who were delivered and succumbed after delivery from the effects of COVID-19. In the United States, their uptake is only 31% have received the vaccines. We are doing our best to encourage our patients to access this vaccine. It's available at every health facility. You know the listing. It's also available in all our antenatal clinics. You will be offered the vaccine. I'll now move on to the next slide, which has to deal with the influenza season that we are now discussing. We've said this before COVID, that this influenza was around. It comes every year in a seasonal manner, and we have a vaccine that's available. We launched the vaccine recently. The vaccine is available at all our healthcare facilities. It's more likely to cause severe illness in our pregnant population when compared with the healthy population. And this has to do with the immunological changes that occur with women during pregnancy, which actually continues after you have delivered your baby. So we are also targeting women after you have delivered to please get your flu shot. Next slide. Right. So again, flu can also cause harm, not just to the pregnant woman, but also to the baby. We know this from other evidence that if you get a very high fever in pregnancy, this is associated with a specific abnormality called neural tube defects. And additionally, we have seen like preterm labor and other complications may occur to both mother and baby. When you get vaccinated, if you're a pregnant woman, you will pass antibodies to your baby during the pregnancy as well as during breastfeeding. Next slide, please. So, the most important step in helping you to prevent the flu, other than the public health measures that we are already observing, will be to get this vaccine. The vaccine is safe. This vaccine is approved at all stages of pregnancy. There's been many, many years of research, and millions of doses of this similar vaccine have been given over many flu seasons. As I said before, the vaccine is available widely. I think I have one more slide. Oh, yeah. I think it's the same slide. So that's it. Thank you very much, Al.
Thank you very much, Dr. Sujit Singh. But before I let you off, the last couple of times you were here, you spoke about a lack of information on the menstrual cycles and those persons who would have had COVID-19. Has there been an update on that particular situation?
Okay, yeah, sure, all right. Yes, I actually did have some information, but I didn't prepare any slides on it. So in the media, we will see articles that keep coming about highlighting the issues with menstrual disturbances and women, and the scientific information and the data has actually remained unchanged over the last few months. There haven't been any new reports in terms of the publications. So some of what you see in the media would be highlighting studies prior to August, which I did speak about. So let me just go back over some of those numbers, which I actually printed out here. So in the United Kingdom, there were 30,000, sounds a lot, 30,000 reports in their database of women with menstrual disorders following vaccine. But this was from 47 million doses. So the number is 6 per 10,000. This regulatory industry here would have made a statement in the United Kingdom, which I like to just paraphrase a little bit. And their statement, which remains unchanged to this date, they haven't changed it, is that they have done a rigorous evaluation so far and still do not support a link between changes to menstrual periods or any of those related symptoms to the vaccine. The actual number of reports of menstrual disorders is low in relation to both the number of people who have received the vaccine to date, as well as the background incidence on how common menstrual disorders are. For those who have had menstrual disturbances, they are reporting that it's mostly short-lived, transient in nature. And there's of course, no evidence, as we've said before, that the vaccines can affect your fertility or the ability to have children. Their advice is similar to what we are seeing in Trinidad and Tobago. If you have concerns, please bring it to the attention of medical staff. At the Directorate of Women's Health, I have actually received only two reports at the Ministry of Health, and I am in regular contact with the heads of departments at all of the hospitals and facilities across Trinidad and Tobago, and they have not reported any patient having any serious effects as a result of vaccines which led them to be admitted to a hospital that deals with menstrual disorders. And that's important. Worldwide, studies have been commissioned, however, and the work is still ongoing. If this changes, Al, we will certainly be updating the population.
Okay.
Thank you, Al.
But what would be the causes of menstrual disturbances, general causes of menstrual disturbances?
Sure, okay. Yeah, Al, you're asking me some difficult questions as usual. So I did actually present some of these this information at the last press conference, and I know the Ministry of Health, what they did is they put it into a short snippet, and it's available on the Ministry of Health's Facebook page. So I'm asking persons, if they wish, they can look back at some of it. But essentially, menstrual disorders are very common on all countries, and that's why we have gynecologists and we have healthcare workers. There are many causes, and some of the things that we have noticed, and there are actually some studies which I've actually had a look at prior to the start of vaccines, which have been published, and they have shown that just the pandemic alone is associated with effects on menstruation and menstrual cycles. No vaccines, just the stress. Some people have experienced weight gain or weight loss. All of these things may cause it. And a recent paper was published which studied a period in the United States of over 12,000 plus 12,300 patients. And 1/3 of these patients, prior to vaccination, actually had disruption of their cycles. So this can happen. In Trinidad and Tobago, we have fibroids, polycystic ovaries, we have thyroid disorders, pregnancy. Some people are missing their periods and think it's an effect of the vaccine, and in fact turn out to be pregnant. We have some cases like that. The important thing is, as I said, if you have concerns, the healthcare system is open. You can visit your local healthcare center. You can talk to your gynecologist. We are here to help.
Thank you very much, Dr. Surjit Singh. On Monday, Dr. Hines reported that there was an upward trend in COVID-19 cases across the country. Mr. Siram Singh will share further insight into these figures and where these increases in cases are actually taking place. Good morning, Roshan.
Good morning. Thank you very much, Al, Dr. Richards, Dr. Surjit Singh, Mr. Alexander, members of the media, and members of the listening and viewing audience. Good morning to everyone. Today we begin by taking a look at our first map, which is a point map. As you switch to that map, please. Thank you. Which covers the period epidemiological weeks 40 and 41. So this covers the period essentially the 3rd of October to the 9th of October. That's epidemiological week 40. And the 10th of October to the 16th of October, which is epidemiological week 41. We compare this point map to our next point map, which covers the period epidemiological weeks 41 and 42. With again epidemiological week 41 covering the period the 10th of October to the 16th of October, and epidemiological week 42 covering the period 17th of October to the 23rd of October, with epidemiological week 41 being the overlap, of course. And generally, as we have seen in the past, the patterns continue with cases favoring the population centers and settlements along the major road networks. Now we look at the same data aggregated at the community level as we take a look at our first choropleth map, which corresponds to the period of the first map, that is epidemiological weeks 40 and 41. And what we see here is aggregation of cases at the community level for that particular period. We compare this map now to our second choropleth map, or community level map, which covers the period epidemiological weeks 41 and 42. And what we see again is very comparable patterns. Most communities continue to record cases, at least one case in the communities, with some minor changes within the communities, so some minor fluctuations. But there are several communities which continue to consistently record a high number of cases. Now, when we look at this data aggregated at the county level, as we switch our first chart, we look firstly at the period epidemiological weeks 37 to 40. So that's the 12th of September to the 9th of October. You may recall this particular chart was shared at our last presentation, and we noted that there were consistent downward trends in St. Patrick, Tobago, and Victoria at that point in time. However, as we move forward to our second chart, which covers the period epidemiological weeks 39 to 42, or the 26th of September to the 23rd of October, 23rd of October. We note that whereas we were previously seeing downward trends, we are now seeing upward trends, consistent upward trends, that is, in St. George West, St. George Central, and St. George East, with the exception of epidemiological week 41 in St. George East, which is slightly less than the number of cases recorded in epidemiological week 40. But nonetheless, we know the upward trends in these counties. We also note that County Victoria, County St. George East, and County Carney continue to be the three counties with the highest number of cases being recorded. I also wish to point out that in County Victoria, during epidemiological weeks 39 to 41, we saw that consistent decrease, but in epidemiological week 42, it shot up past the number of cases which we recorded in epidemiological week 39. So Dr. Hines would have mentioned on Monday the continuous increases we have seen at the national level. We are seeing now that there are counties which are showing this similar increases at the county level, and now we wish to take a look at what is taking place at the community level as we switch to our national space-time trend analysis map, which shows us essentially in red communities which have recorded upward trends, and in blue communities which would have recorded downward trends. We note, of course, those communities which are colored a light gray to white color are those communities in which there were no identifiable trends. Now, as we look at it, we note that there were approximately 45 communities showing upward trends and 26 communities, roughly, showing downward trends. So the number of communities showing upward trends, and strong upward trends, I might add, as evident by the dark red color, have surpassed those communities showing downward trends. Now, in terms of its contribution to the national numbers which we have been seeing, the overall increases which we've been seeing, the upward trends communities, of course, these are driving the increases at the county level and at the national level. But these are not the only communities which are driving this. Those communities which are colored light gray to white, in which there are no identifiable trends, are also contributing because cases are also being recorded there. It's simply a case that in those communities with no identifiable trends, there is no consistent increase or decrease in those communities. So there's some amount of fluctuation taking place. But these communities are contributing nonetheless to the increases that we are seeing nationally. So we are seeing the increase nationally in terms of the overall numbers. We are seeing the increase in certain counties, and we are also seeing the increase in communities within the counties. So we are actually seeing the aggregation as we move up. As we switch now to our map of County Victoria, we see that there are 10 communities which recorded upward trends during the period epidemiological week 39 to 42. We then switch now to County Carney, in which there were 6 communities showing that upward trend and a handful showing a downward trend. Then we switch to County St. George East. Again, several communities showing upward trends, some strong upward trends as well. And we see similar patterns in our next map of County St. George Central, followed by the map of County St. George West. So again, nationally we are seeing the increases, and we've noted it over the last month or so. At the county level, we are seeing the increases, and within the counties, we are seeing communities also recording increases. And what is there for us to learn from this? Well, tomorrow, as we celebrate Diwali and as we approach the festivities, we need to remain mindful that COVID-19 is present. It's present in the general population and in the majority of communities across the country. So as we approach the festivities and all of the activities of tomorrow, we want to ensure that we continue to follow the guidelines of washing your hands, wearing masks, and watching distances. And of course, please take the opportunity to get vaccinated as soon as possible if you have not yet taken that opportunity. And as I close today, I remind everyone that for credible information, we could access the Ministry of Health's website at health.gov.tt, and there's a GIS dashboard which provides us with some degree of spatial information there. Thank you very much.
Thank you very much, Mr. Siram Singh. We will now move to our question and answer segment, where we ask members of the media to please indicate your name and the name of the media house that you represent before posing your questions. In the interest of time, we ask for a maximum of 2 questions per media house initially. We will take our first question from AZP News.
Good morning, Praya Vihari, azpnews.com. My first question is for Dr. Surjit Singh. Dr. Surjit Singh, we have seen an increase in pregnant women from July, August um, this year. Why do you think that that increase has occurred? What has the contact tracing done? And are most of these cases in the public healthcare system? That's my first question. My second question is on the cruise ship industry. I've sent my questions to the Ministry of Tourism, and they have referred me back to the Ministry of Health. So I'm asking, are we any closer to having the cruise ship industry open up? Because some of the stakeholders are saying that the passengers and crew members on these cruise ships will be fully vaccinated, just like our people coming via the airport. So I just wanted to get your take on how close we are to having the cruise ship industry open again. Thank you.
Thank you very much. Dr. Surjit Singh will take the first question and Dr. Richards will take the second.
Okay, thank you, Prior. Okay, so the question you asked is why did we see that rise in the number of cases for the last couple of months? And the simple answer is this actually is reflective of the general rise that we have had seen in the population. So that's one possible reason. We do conduct a significant number of screening activities in our clinics. So we screen all our pregnant patients when they're being admitted for surgeries, or if they're being induced or being admitted to hospital in general. So we do a lot of screening, of course, to protect patients and to protect staff and protect the visitors who attend our hospitals. I want to advise and emphasize this, that these are patients who are getting infected in the community. This is not occurring in the hospital setting. These are persons, just like the general population, are being exposed, and generally, the same risk that we all have, the pregnant women have that same risk. They don't have an added risk of getting ill, of contracting the virus, but when they do contract the virus, they are more likely to get very seriously ill. That's important. Now, in terms of the public healthcare system, we are fully equipped to manage our pregnant women. We have put systems in place. I want to reassure you, from the time you get pregnant, if you need to access those services in our clinics, if you need to access laboratory services, ultrasound services, inpatient services, post-delivery services, Trinidad and Tobago should be proud of our healthcare system and the healthcare workers especially. We have all in place to maintain very high standards. Thank you, Prior.
Dr. Richards?
Good morning and thank you, Prior. The decision regarding the re-entry of cruise ships is a policy decision that needs to be made by the Honorable Prime Minister. So the Ministry of Health will just provide the relevant information. However, this is a policy decision made by the Honorable Prime Minister and members of the Cabinet team. Thank you.
Thank you very much, Dr. Richards. Radio Tambrin, you're up next.
Hi, good morning. Clayton Clark from Radio Tambrin. Right, my two questions, let me start with the local one first. There has been much discouraged up to this morning about comments made that doctors may have to choose. Are you hearing me?
Go ahead.
That doctors may have to choose vaccinated patients. There's much discussion on the local media this today where comments were made that doctors may have to choose vaccinated patients over those who are not vaccinated to have access to limited ICU beds. So can I get a comment on that? And secondly, this is a question sent in by a member of the public saying that the person is aware that or been informed that in the US that vaccines take to have booster shots. Can you confirm, debunk, or clarify this statement? And if so, what is the position here in Trinidad and Tobago?
Okay, could you just repeat Could you please repeat the second question? Okay, Dr. Richards, could you we deal with the first question and then we'll come back to
Sure.
Radio Tamron.
Good morning, Mr. Clark. Thank you very much for raising a very topical matter, which, of course, is in the public domain on today's newspaper. At last Wednesday's press conference, the Honorable Minister would have stated that vaccination status is not a criteria for the admission of a patient into the intensive care unit of our hospital. Dr. Trotman, who also leads the clinical management team across the RHAs, would have confirmed this in her presentation. So this morning, the Ministry of Health, through the Honorable Minister of Health, Minister Diyal Singh, would like to confirm that vaccination status is not a criteria for the admission or transfer of patients into the intensive care units. We would, however, like to remind the population that vaccination is the population's tool to reduce admission into the intensive care unit. Thank you.
Thank you very much, Dr. Richards. We go to Guardian Media Limited for your two questions.
Hi, morning everyone. Rashad Khan here from Guardian Media Limited. Okay, so my first question is to Dr. Abdul Richards. Dr. Richards, what you would have indicated when you gave that update on the occupancy of the ICU wards in the parallel healthcare system, it seems to indicate that there are less patients now in the ICU than what we would have been told was the occupancy last week. So is that because patients are recovering, or is it because patients have died and now left those spaces vacant? And my second question will also be to you, Dr. Richards. Tomorrow is Diwali. Any advice from the Ministry of Health for people who will be celebrating Diwali tomorrow? Is it advisable that they could even set up their own little safe zones when they're inviting family over? Thank you.
Good morning, Rashad. Thank you for both questions. So the first question centered around the occupancy levels in the intensive care units. Firstly, I'd just like to advise the population and to just give some further information on the intensive care unit situation. Admission to the intensive care units is a dynamic and evolving situation, and we monitor clinically and statistically and at a policy level in real time the occupancy levels and the persons being admitted from the community via the GMRTT ambulance service into our hospitals and into the parallel healthcare system. So this is a very dynamic or fluid situation that requires real-time monitoring. The occupancy level today, yes, is less than we would have seen over the past 15 days or so. The consistent trend would be the high numbers of unvaccinated persons or persons who are not fully vaccinated into the intensive care units. A preliminary analysis has shown that there has been an increased number of deaths, unfortunately, and these deaths really come from the persons who require intensive care unit level treatment. However, we collate this data and verify it, and this will be provided via Dr. Hines in a subsequent media press conference. Your second question, based on Diwali, the Ministry of Health and all our doctors and nurses, the Honorable Minister and the Ministry of Health team, we would like to impress upon the population the role of civic, personal, and social responsibility. The Delta variant is now well established in our community. It is highly infective, more infective than any other variant that we would have encountered. It is highly transmissible, and it increases your risk of being hospitalized and, of course, being admitted into an ICU level care at one of our facilities. We ask members of the population to please continue to follow the 3 W's, even if you are fully vaccinated. Let's wear our masks, let's wash our hands, and let's watch our distance. And please exercise caution with respect to commingling. Let us not be prematurely comforted or become complacent by the fact that we are fully vaccinated and that we are gradually reopening the and relaxing restrictions as we try to return to a state of normalcy. Thank you very much, Rashad, for the opportunity to answer your two questions.
And thank you very much, Dr. Richards. We go to the Newsday for your two questions.
Good morning, everyone. Rihanna Mackenzie here from Newsday. My two questions this morning are for Dr. Richards. My first question is, it is being said that nurses are not receiving their vacation time due to the demand for nurses and frontline staff during the pandemic, especially in the ICU and the HDU, as you would have indicated. Can you comment on that? Is this true? And what's being done to relieve frontline workers when they do need their time off? Secondly, there are also concerns about the working conditions, having to work in excessive heat, for example. It's being said that AC units in the ICU and HDUs are not working. What's going on there? What's being done about that? Thank you.
Thank you very much, Ms. Mackenzie. These are two operational concerns, and thank you very much for highlighting them, that really would be addressed and under the purview of the relevant regional health authority. Nationally, the Ministry of Health, in conjunction with the Chief Nursing Officer and the School of Nursing, continues to train nurses to increase the capacity of nursing personnel throughout the healthcare system, both in the traditional and the parallel healthcare system. And also the operations at the facilities in the parallel healthcare system are monitored by the chief executive officers. So this would be an RHA specific situation that really falls under the purview of the relevant chief executive officer of the RHA. Thank you.
Thank you, Dr. Richards. We now go to the TV6 for your two questions. Good morning.
Good morning, Renessa Cutting, TV6 News. Both of my questions are for Dr. Abdul Richards. Is it that we are seeing a trend where persons are unwilling to be admitted into the parallel healthcare system? And if you have the information, could you share why those persons would not have wanted to be admitted? And also, given the fact that we are dealing with a pandemic, we have a highly transmissible virus, does the ministry find or ICU capacity to be satisfactory at this time? A total of 5 beds for the island of Tobago, 58 here. Is that a satisfactory level? Thank you.
Thank you very much for your questions, and good morning, Ms. Cutting. The Ministry of Health, as I would have indicated, does real-time or carries out real-time monitoring of patients being transferred throughout the system. And of course, we work very closely with the clinical management teams of each regional health authority. The reasons for patients not being admitted to the parallel healthcare system, despite clinical deterioration or what we say decompensation, that is, their heart rate may be increasing or they may be having difficulty breathing, is multifaceted. And we can't make a determination at the Ministry of Health level as to why a patient would not want to be admitted. However, the Ministry of Health can encourage and educate patients, as we continue to do, about the signs of clinical decompensation. Our county medical officers continue to monitor the patients who are in home isolation on a daily basis, as well as their relatives who are primary contacts. So on the ministry side, we are doing all in our part to ensure that persons are admitted when their clinical signs are deteriorating. And we have a clear policy that the Ministry of Health uses to determine when a person needs to be transferred or when they can continue to be managed at home. So we need your cooperation in terms of the population. Please, if you see your relative or if you yourself find that you are deteriorating or decompensating, this is the only way to save your life. The second question centered around the Ministry of Health's capacity to manage ICU level care patients. And I'd like to reiterate that over the last 16 days, our demand significantly increased. And yes, we did have less beds in the ICU available as previously, but the Ministry of Health continued to work based on the demand for beds and the advice of our clinicians and the clinical teams to increase the number of beds. We added 10 beds at the St. James Medical Complex based on the demand that we saw at the NWRHA. we added 4 beds on the weekend at the intensive care unit department of the Cuba Medical and Multi-Training Facility, 2 beds at the Arima General Hospital. And in Tobago, the TRH and the THA are working closely with the Ministry of Health and collaborating, as we always do, to increase their ICU capacity. So thus far, despite the increase in demand, we continue to monitor the situation and allocate resources, and we have been maintaining that demand. It's been exact at some times, but we continue to ensure and to try our very best to save lives. However, I would like to remind the population that resources are limited, and if we continue along this trend, they will eventually be expended. So thank you very much.
Thank you very much, Dr. Richards. TTT, you're up next. Good morning. Good morning. Okay, you're muted. Could you unmute? TTT, good morning.
Good morning.
Right, we're
Terry
hearing
and
you.
Brown Campbell. Terry and Brown Campbell from TTT News. Both of my questions are for Dr. Abdul Richards. With the reopening of school over the last month now, has the ministry seen more children presenting with the virus? And in addition, could we get an update on the number of children currently being treated for the virus? Thank you.
Thank you, Ms. Campbell. The Ministry of Health continues to, via the County Medical Officers of Health, monitor the situation with respect to school children in conjunction and led by the Ministry of Education. The Ministry of Health continues to advise members of the population and parents to please take up the vaccination that is available across the country, because we have a vulnerable group, which are young children who cannot be vaccinated. The only way that we can protect these children and reduce the risk of transmission, and obviously if they acquire COVID-19, they may require hospitalization, is by those around them who can be vaccinated to do so. So we continue to monitor the situation via the County Medical Officers of Health and through the Ministry of Education. Your second question pertained to the actual number of children who are COVID positive at this time, and that information can be obtained through the Corporate Communication Department of the Ministry of Education. Thank you very much.
Thank you very much, Dr. Richards. We go back to Radio Tambourine for a follow-up question.
Hi, good morning again. My follow-up question with regards to, well, interestingly, following up on the last question in terms of schools, has there been any consideration, any talks to allow standard 4 and 5 students, some of whom are 12 plus, to return to school physically in January?
Thank you very much, Mr. Clark. The decisions regarding the commencement or recommencement of school children from that age group is a policy decision that will be the responsibility and under the purview of the Honorable Prime Minister and his cabinet. So we would have to await his decision on that matter. Thank you.
Thank you very much. Finally, we go to Guardian Media Limited for the follow-up question.
All right, morning again. Dr. Abdul Richards, you would have mentioned that case of these 3 people basically taking too long to come into the hospital system, right, with COVID-19. How much of an issue is this really for us, and how much of an impact does that have on our demand for ICU spaces?
Thank you again, Richard. Over the last 16 days, there has been a consistent trend of persons presenting or entering the accident and emergency department in a severe or critical medical condition. We have also noticed that 90% of those persons, in excess of 90% on a daily basis, are unvaccinated or not fully vaccinated. This trend suggests that the population can alleviate the demand on ICU beds through vaccination, one, and also through contacting the GMRTT service or the County Medical Officer of Health to inform them of a decompensation or a worsening of their clinical condition. We have a primary healthcare team that is on call 24 hours, 7 days a week. We have teams of specialists that manage the calls that the GMRTT receives. The GMRTT has increased the number of ambulance units based on the demand for care, and they've also increased the number of advanced life support units to transport persons who may require immediate intubation or ventilation and transport to the hospitals. We are doing all in our power and in our ability to save lives. The onus is now on members of the population to please take up the offer that the Ministry of Health continues to provide regarding vaccinations. And also, if you do have COVID-19 and are confirmed positive, please monitor your clinical signs and follow the medical advice. Thank you.
Thank you very much, Dr. Richards, but we will stay with you a little while for follow-up.
So, ladies and gentlemen, tomorrow is the auspicious occasion of Diwali. Diwali symbolizes the triumph of light over darkness. We, the health team, the frontline medical staff, all volunteers who've assisted in the COVID-19 national response across all ministries, the private sector, the chambers, the diplomatic community, the multilaterals, we are kindly asking you to assist us to overcome this dark period of the pandemic. We appreciate your patience, we appreciate your support, and we appreciate all that you've done in terms of complying with the public health regulations, of complying with the 3 Ws. However, our way out of this dark period, our way to save the lives of our relatives so that they can be with us for another Diwali celebration, is vaccination. Let us continue to accept the request from the Ministry of Health and please let's educate and empower our relatives so that they will now become vaccinated to save their lives. On behalf of the Honorable Minister of Health, the Chief Medical Officer, the Ministry of Health's team, Dr. Hines, Dr. Trotman, myself, as well as every frontline medical personnel, we would like to wish the Hindu community and all members of the population Shubh Diwali. Thank you very much yet again for joining us at our conference.
Thank you very much, Dr. Richards. Well, we have come to the end of today's media conference. Thanks to our presenters, media representatives, and your viewing and listening public for sharing your time with us today. I also want to remind the population that both the flu and COVID-19 vaccines are still available at health centers across Trinidad and Tobago. And as we close, we leave you with another Voices for Vaccination video. This one is from Miss Isabel Julian. And I'm saying, like my panel, Shubh Diwali, and be safe, everyone, and goodbye for now.
Good day, TNT. My name is Miss Isabel Julian, and I am urging the public to please go out there and take the vaccine. I have taken the vaccine. I have no complication. I have no problem. In order for us to get herd immunity, we have to take the vaccine. I have my grandson home. I have my son, my children home. I would not like to carry the virus home and infect anyone. I am begging you, TNT. We have the frontline workers, the nurses, the doctors. They are all doing their part since 2020. Let's vaccinate, TNT.